no doubt about that. And that, with the restructuring and prohibiting the subcontract, that makes no sense to me whatsoever. And I believe, why restructure when it works? And I think you are doing a tremendous job in what you do, and we have to resist these cuts to the best of our ability. But we must keep Medicaid dollars for Medicaid programs, and that is the name of that tune. And you've gotten that message out there very, very well. So on behalf of the Speaker, he regrets he could not be here, but things are changing rapidly, and they're meeting with the governor now on the stimulus and other issues that are out there related to the budget. But you're here, your timing is good, and as I said, don't hesitate in your home districts to contact your local members of the legislature, regardless of party, and impress upon them the need to make some of these restorations in your field and what you want to do, and the need for some additional revenue to address the budgetary picture in general. So I thank you for being here. Keep up the good work that all that you do, and I'm hopeful and I'm optimistic that the final budget product will be better than what we're facing now. So thank you very much.
For the time being, when it comes to Medicaid, and we need to take it for Medicaid. We don't need to simply transfer it to other pet projects. We need to make sure that the dollars for Medicaid go to groups such as yourselves to help the people that you help. And that's what we on the Democratic side are trying to do through this budget process, and we are working very hard to make sure that those monies, the Medicaid monies, go to Medicaid projects. So that's what we're looking forward to do in this project. But I'm also here really today to thank you on two levels. One, for my constituents, for you provide the safety net for my residents who are in need. The fact is that how better to get better than being in one's home? Being around the places that you are comfortable with. And we need to make sure that you do your profession in the best way possible. And there are provisions in this budget that will not help you. And I am committed to working to making sure that those provisions get taken out.
And I believe that federal money ought to be able to enable us, first of all, to avoid doing the Medicaid cuts that the governor has proposed that are clearly cutting for the sake of cutting, and that are clearly not anybody's idea of a programmatic change in the healthcare system. Cuts in trend factors and things of that sort, which are a big part of the governor's Medicaid package. I don't think really anyone in the executive branch would argue that those make programmatic sense, other than being part of our response.
Because of my commitment to people who are most vulnerable, who are most at risk, who may not always have the strongest voice, who can't always fight as hard for themselves as would be best. So I feel like it's my job to be their champion, and that's really why I even ran for office to begin with, is to champion people whose voices are not necessarily the ones that are heard the loudest or the strongest, but that need to be. So that's my pledge, that I'm going to keep doing that. It's the reason I get up in the morning, and I look to you to be a really strong partner in making sure that people get the services that they need and deserve, and the people who are providing that service get the support in every way that they need and deserve.